Thank you, everybody. Sorry for the delay here. I want to just begin by, sorry we have no ALS interpretation. This will be posted, captioned video on TV. I'm going to provide COVID updates today, and then Congressman Stephen Lynch and I will discuss the American Rescue Plan, which President Biden signed into law last week. Chief Marty Martinez is also going to speak on the any COVID updates that are going to happen. So we'll start with COVID. The latest state numbers. These are numbers as of yesterday. We had 1,508 new confirmed cases in the Commonwealth of Massachusetts. We had 30 new deaths recorded yesterday. In Boston, we had 137 new cases. 2 deaths were recorded yesterday. And as always, our thoughts and prayers go out to the loved ones who've lost family members during this difficult time, and also anyone still sick and suffering from COVID-19. We want you to know you're in our thoughts and prayers. The latest complete data that we have for the week ending March 7th, we had an average of 3,942 Boston residents who were tested for COVID every day. The 7-day average daily positive tests were 165. The average daily positive rate was 3.6%. As of March 10th, 23.7% of Boston residents 16 years or older have gotten at least 1 dose of the vaccine, and 13.3% of the Boston residents have been now fully vaccinated. More details and data is available if you go to bphc.org. Our case numbers have stayed below our thresholds for concern for several weeks here. The numbers of people hospitalized continue to go down. Many people who are getting more and more people are getting vaccinated every day, and help is on the way from the federal government. So I just want to, those are good numbers to have and what we want to talk about here. But we are certainly not out of the woods yet. Everyone has to stay focused so that we don't slip backwards. We were asking everyone to continue to wear masks, wash your hands with soap and warm water. We're asking you to avoid large gatherings, frequently get tested, and if you've been vaccinated, look to the CDC guidelines on activities that you should do. Don't assume because you're vaccinated all of a sudden now you can take the mask off and go into a crowd. You want to make sure that you follow the guidelines still to keep yourself safe. You can get those guidelines at cdc.gov. St. Patrick's Day is this week, and I want to thank the people of Boston for doing a good job this past weekend. We didn't have many reports of large gatherings. City departments were out enforcing safety protocols in our restaurants. For the most part, everyone was in compliance. There was no emergency license board hearing that we needed this morning, which is a good thing. I want to thank our restaurants, restaurant owners, and all the staff and all the patrons for your cooperation over the weekend. We need everyone to keep it going this weekend as well, the weekend that's coming up here. As I said last week, having a party and potentially causing an outbreak, it just isn't worth it at this point. I've been at this podium now for the last couple of weeks and reporting that the numbers are going down, and we want to continue that trend in the right direction. And I want to thank everyone for continuing to do their part. Testing is still one of the most essential tools that we have to control the spread of the virus. Again, we're asking everyone to commit to getting tested if you can once a week or at least every other week. We're asking employers to support their workers in getting tested and encourage their workers to get tested. You can make that commitment and help and find helpful resources at boston.gov/testingpledge. That's boston.gov/testingpledge. We have over 25 testing sites still operating in the city of Boston. We have mobile sites that are free and open to everyone regardless of symptoms. And this week those sites are in Jamaica Plain at the Anna Cole Community Center at the Mildred Haley Apartments, in Hyde Park at the Boston Renaissance Charter School, in Dorchester at the Strand Theater and Prince Grand Lodge Hall. And for more information about accessing these sites, please, or any other sites in the city, you can either visit boston.gov or you can simply call 311. As far as vaccines, we continue to support the state in the vaccine rollout. Right now, adults 65 and older and adults with 2 underlying health conditions are eligible to get vaccinated. That's in addition to everyone eligible in phase 1. As of last week, teachers, child care workers, and K-12 school staff are now eligible as well. I was at a school this morning, and 17 of the teachers inside the school were vaccinated over the weekend. They were excited to get vaccinated, and there's more teachers going to be vaccinated. Another teacher had an appointment for later today, so it's good to see that the vaccinations now are happening for our teachers and our staff in our schools. For any information on eligibility, you can go to mass.gov and you can find all the information, as well as the opportunity for anyone to pre-register on mass vaccination sites. So that's something that's important. Anybody can pre-register now for a vaccine, so as they become available, you'll be able to contact you. We have vaccination sites all across the city that are open and eligible to all residents. We also have resources that can help you access them. Boston residents that are 65 and older can call 311 and get connected to the city's Age Strong Commission for help in multiple languages. So if you're a Boston resident, you're 65 and older, and you want to be able to get a vaccine, you can either go online or you can call 311. If you're a Boston resident, if you're a Massachusetts resident, you can call 211 and get that same information and help. If you're a veteran of any age, and if you're enrolled in the VA healthcare, you can get vaccinated at any VA healthcare facility. Our Office of Veteran Services is continuing to partner with the VA on walk-in vaccine clinics. We had one of this past Saturday at the VFW Post 1018 in Dorchester. I want to give a shout out to City Councilor Ed Flynn and Commissioner Rob Santiago, who did some amazing work in outreaching to our veterans and getting that clinic up and running. We'll have another one this Wednesday, March 17th, at the William E. Carter American Legion Post in Mattapan from 10 a.m. to 1 p.m. This coming Saturday, March 20th, at Urban Edge on Columbus Ave in Roxbury will be another clinic from 10 to 1. Free transportation is available for both of these clinics if veterans need it. For more information, go to boston.gov/veterans, or you can just call 311. For teachers and school staff, this weekend, BPS launched a vaccination clinic for BPS staff at the Boston Center for Youth and Families Galvin Community Center in Mattapan. It's open to teachers, staff, bus drivers, all BPS employees and contractors. It's open Sunday to Thursday this week and next. It will be open again in a few weeks to provide second doses. The Boston Public Schools are also partnering with the Boston Teachers Union to offer a second location at the Boston Teachers Union Hall in Dorchester when more doses become available. So I want to thank Jessica Tang, the president of the Boston Teachers Union, and the teachers for opening up their union hall so that we can make sure that our teachers and staff and bus drivers and custodians and everyone gets vaccinated. Today, Boston Public Schools welcomed in students from grades 4 to 8 back into in-person classrooms if their families opted in. This morning I was at the Roosevelt, and it was great to see the kids back in school. Some of these kids I saw today in class have not been in class for over a year. So that's really important, and if the public health data continues to show us good signs, we're going to continue to bring in on March 29th grades 9 to 12 kids back into school. Currently, in-person school is hybrid learning, which means that parents can opt out, or opt in, actually, if they want to send their kids to school. The state, last week, is calling on all districts to give all elementary and middle school students the option of full-time in-person learning beginning in April. The Boston Public Schools and Dr. Casilius is working towards this goal. We're going to continue to respect the family's choice, so remote learning will be an option for all families. Boston Public Schools sent out a survey this morning asking families their preference, remote learning or fully in-person learning. Families are asked to complete this form for each child in your school, in your household, by Monday the 22nd. For more information, go to bostonpublicschools.org. Also, we have good news for many restaurants. 2 weeks ago, I announced the approval of restaurants could begin outdoor dining on April 1st and possibly sooner, weather permitting. I'm announcing today that we are moving, actually I think it was announced Friday, but I'm re-announcing, I guess, today, that we are moving up the opening date to March 22nd. We will once again allow dining on some roadways and public spaces. The Boston Disabilities Commission will also provide ramps to restaurants who need them, like we did last summer. And also an important note, due to the high density of restaurants in the North End neighborhood, the North End restaurants will begin on April 1st. They will not begin on the 22nd. Setup in the North End is going to begin on March 29th. We've been proactively reaching out to small businesses. We've held help sessions through the winter to businesses navigating the pilot process, and the city has made hundreds of personalized calls to businesses that applied for outdoor dining last year. We are putting a big emphasis on outreach to businesses owned by people of color all across the city. Our Office of Economic Development has been working with the Boston Black Hospitality Coalition to promote technical support and assistance that the city can help provide those businesses. The city will continue to host office hours for workshops to help businesses with their applications. So any business that's having a hard time with applications, our Office of Small Business is here to help you. To learn more, you can go to boston.gov/2021 outdoor dining or call 311. With more people getting vaccinated, students returning back to the classroom, and restaurants resuming outdoor service, the light is at the end of the tunnel is growing bigger and brighter every single day. But we still have a long road to go for recovery. Every day at City Hall, we're looking at the economic data, and we're listening to the frontline workers, families, small business owners, and the industries that are impacted most by COVID-19. It's clear that the harm done by this pandemic is deep and could be long-lasting. We've worked hard as a city to make sure that we support each and everyone's needs together over this past year. Every department in City Hall is working around the clock to serve our residents. But in many ways, the work of recovery is only beginning. So I'm grateful that there's help on the way today, and we're able to talk about it. The American Rescue Plan was passed by the House and Senate last week, signed into law by President Biden on Thursday. I want to thank the President, the Congress, and especially the Massachusetts delegation, who have been leaders in Washington throughout this pandemic. I'm proud to advocate with them as partners for the help that our communities need all across America. I was proud to advocate with my bipartisan fellow mayors throughout the U.S. Conference of Mayors for a comprehensive recovery plan. I have a whole list here, but I'm going to pass that off for a minute before I go through my list, because I really want to thank Congressman Lynch, who's with us today, who we've spent many, many hours on the phone over the last couple of months talking about what's needed here in Boston, what's needed here in the Commonwealth of Massachusetts, and what's needed here, quite honestly, in the country. And Congressman Lynch, along with the other Massachusetts delegation, I'll let the Congressman talk about them, have been really champions. I have not had to call the Congressman and explain to the Congressman the importance of passing this piece of legislation, one of the largest, if not the largest, in the history of the United States of America. So without further ado, I'm going to ask Congressman Lynch to come up here and talk about this plan.
Thank you, Mr. Mayor. Good morning, everyone. So, first of all, I want to just give great credit to President Biden for his leadership on this. Clearly, he was the spearhead for this effort. As well, I'd like to recognize Congressman Richie Neal, who's the chair of Ways and Means, who, in terms of having our goals and having talked to both the governor and the mayor, and all the mayors in my district, in terms of translating that into action, Mr. Neal was extremely helpful, as well as Catherine Clark, a member of leadership, and the entire delegation. And in coordinating for the efforts in the city of Boston, Congresswoman Ayanna Pressley was also instrumental in pushing our agenda in terms of what we thought was most needed for our area. So this bill is meant to address a problem of such enormous scope that it is unprecedented, that the bill itself had to be of equal scope and equal impact. We virtually looked at every aspect of society that was being impacted by the pandemic. We looked at the loss of revenue. That was our baseline. We had to go back to 2019 numbers to look at what cities, towns, states were bringing in pre-pandemic, and then try to replace some of that revenue, reimburse the states and cities, counties, towns, and tribal governments for part of what they would have earned had not the pandemic occurred. And I'm very happy to say that we were able to get wide agreement, at least in the Democratic caucus and the House and Senate, in terms of what would happen next. The main areas that we looked at in the short term were obviously the research, the rollout, the development, and the delivery of vaccines. There's about $130 billion in that tranche of money. We targeted areas. So while most of the money in the American Rescue Plan is targeted by population, we also took a very hard look at areas that had been more heavily impacted, either because of high minority populations or poorer neighborhoods that did not have the existing infrastructure from a healthcare standpoint. Looking at those areas, so we were able to direct more money. We have a reserve fund for areas of low income and very diverse communities that have a greater level of need. We also looked at, in terms of the housing money, we looked at areas that had extremely high rents. And so when we looked at rent relief, obviously those areas, like Boston, received heavier demand and greater pressure on their housing stock. So we tried to help those areas as well in a greater level because of the increased demand. We looked at the chronology and the sequencing of putting America back to work. So we looked at not only the healthcare aspects of it, and we took special care. There's $7.6 billion here for community health centers, and as the mayor and I know, we rely so heavily on community health centers in Massachusetts. We have a very vibrant community health center community that service so many of our cities and towns, that we made sure that they got direct funding. A number of those health centers are stepping up to take on greater responsibility with the vaccine rollout, as well as the day-to-day work that they do throughout the year under normal circumstances. So we hope that is able to plus up our response. We're also looking at trying to divert the federal vaccine pipeline to federally licensed health centers. So right now, we're obviously through the federal pipeline. We're providing vaccines to the VA and to any federal employees within the Commonwealth. But we also think that there's a way to expand that by the VA providing vaccines to principal care providers within the family, and also diverting an extension of our federal vaccine pipeline to include federally licensed health centers. So that will take some of the pressure off the state in terms of the numbers of vaccines that they're receiving every week. We have thankfully seen a marked increase in the number of vaccines available. If you go back to about a month ago, we were probably seeing 108 to 130,000 108,000 to 130,000 vaccines for Massachusetts per week. Since President Biden has kicked this into higher gear, we're probably seeing closer to 155 to 160,000 a week now. And with the advent of the Johnson & Johnson vaccine, even though they initially only came in with 4 million additional doses that were in place when they received their emergency use authorization, they expect that by the end of March, they'll be able to plug in an extra 20 million doses into the pipeline. So that will help us respond in a more meaningful way. It'll help us with teacher vaccinations. It'll help us with people that have been waiting, that have dual health issues, and so we expect we're moving in the right direction at an accelerated pace. We also looked at the expectations that some states were going to begin opening their restaurants to a greater number of patrons. So we created a restaurant stabilization, a restaurant revitalization fund with about $28.6 billion to try to help that effort. And we'll rely on individual states to set those guidelines, but the money will be there to provide that additional assistance. There's about $350 billion overall for states, cities, towns, and tribal governments. So again, largely based on population, but with a few extra increases for areas of higher impact. There are also the whole idea here is that we want to get America back to work, and that will require all aspects of our society to reemerge. In terms of transportation, and I sit on the Transportation Committee, we did an extra $8 billion for airports. There's about an equal amount of money for airlines and airline employees. We obviously provided about $800 million, I think, and additional almost another $1 billion for the state in terms of their transportation systems, and then a targeted increase for the MBTA as well. I anticipate a question from earlier today about the decision of the MBTA to continue to cut back on services, and also there's a move afoot, and I've been back and forth with General Manager Poftak to furlough about 40 of our conductors over on Keolis on the commuter rail. I have to say, on behalf of the delegation, that is not consistent with our intent here. So we're providing all this money, and this is taxpayer money, mind you. We're providing taxpayer money to the MBTA to provide services to the taxpayer. So we are in total opposition to the reduction in services, to the laying off of employees, of furloughing employees. The whole idea here is to move the country and the state and our cities and towns back to a more normal pattern of life. And so it is incongruous with our intent, speaking for the delegation, that an agency would take federal support from the taxpayer and then cut services to those same taxpayers. That doesn't work for us. So we're going to have some hard discussions with the MBTA and with the governor. We hope that more thoughtful ideas would emerge from those discussions, and that there would be a pullback on the reductions of service to the public, and also an elimination of any proposed furloughs or layoffs for those transportation employees. This is a big bill. Every aspect of our society is trying to be addressed. Trying to think if I did mention earlier the rent relief and homeowner relief, significant amounts of money there. We've provided, I think, $130 billion for schools. There is a segment in there for higher education, as well as $3 billion for parochial and private schools. That was put in there as well. Many of the parochial and private schools had tried to operate throughout the pandemic, but necessarily may need improvements to their ventilation systems and other aspects of allowing those schools to continue to operate. Let's see. I think that's. I'm sure I've forgotten a few things, but why don't we stop there, and maybe we could begin to take questions.
Congressman, can you talk a little bit about what the delegation specifically did to try to get more vaccine to the state? The governor was criticized by the delegation for some of the early rollout. I just keep saying this is the issue. This is the issue.
Yeah. Well, in fairness, we own some of that too. So we were critical. I want to say one thing. We were respectful. If you read the letter that we sent to the governor, it was entirely respectful, and we acknowledged the difficulty that the state was having under the circumstances. So there were several rewrites of that letter, and the one that finally went out was quite respectful and acknowledging of the difficulty the state was in, and it was more. And we acknowledged that, as I said before, we were only getting 108,000 doses for the governor, or 130,000 doses at one point per week, and that was far short of the demand. So that we own that, right? You know, this was coming through the federal pipeline. So, but nevertheless, we were seeing and we were hearing, significant complaints about how the delivery aspects of the vaccine process was going forward, and that's where we asked for a sort of a registration system where people weren't going out to sites and then being turned away. That was really infuriating people, especially those who had healthcare complications. So we were asking for a more methodical and logical process of having people register so they know when they go out there would be a shot, so that there would be a shot available for them. So that was really what we were getting at, and I'm happy to say that the governor and Secretary Sutters acknowledged that and revamped in a way. So now we're getting more and more vaccines available. We've tried to work pretty closely. I had a Zoom call pretty recently with the mayors and senators and state reps in my district with Secretary Sutters just to explain what was going to happen next. We identified some areas that were lacking. So we've had good communications with the governor and with Secretary Sutters. In terms of what we saw within the state, and I speak for the entire delegation, we all, were getting the calls and hearing from our healthcare providers where there were gaps. And so we try to translate that into the legislation, sitting with Richie Neal and his staff, basically trying to make sure that, and our state was probably a microcosm of what's going on elsewhere in the country, just making sure that we looked at populations that were not receptive to the vaccine to try to, so we put a messaging piece in the bill that actually tries to build confidence, sort of the public relations aspect of this, to explain to people and to convince them that getting the vaccine is the right thing to do. We saw that in certain areas in the state, and we also saw areas that had, in my own district in Brockton, was the second highest COVID hospitalization rate. So I recognize that, and we try to work towards that reserve fund, which targeted areas like that, like Brockton in my district, and parts of Boston that had a higher incidence of hospitalization and a higher death rate and infection rate. So we tried to make sure that the bill addressed the reality out there, rather than a straight formulaic response in terms of population. We also try to address need and demand out there. So I'm just very proud of the delegation, not only the House delegation, the Senate delegation as well. There were some important changes that were made. There were some plus-ups for various aspects of this. I think the VA funding went up when the bill went over to the Senate. Some of the money for our first responders went up when it went over to the Senate. We did lose the $15 an hour minimum wage. However, I think that was more of a function of the Byrd rule, and that's why that went down. And we are not giving up on that. It's just been delayed. So. Yeah, very proud of every member of the delegation. A number of us, myself and Congresswoman Presley, were on committees of jurisdiction. So when the funding bill went out under reconciliation on oversight and on financial services, we were part of that process. Also, we put some transportation pieces in this, so it went to, I sit on the transportation committee as well, so we were able to review that and have impact. And we also anticipate that we'll have a major infrastructure bill coming out pretty soon. So we're pretty excited about that. And again, I think the delegation is well positioned with Mr. McGovern and Rules, with Mr. Neal at Ways and Means, with Catherine Clark in Leadership, myself, Mr. Moulton, and Mr. Auchincloss are all on transportation. So so I think other than Texas and California, Massachusetts has more members on the Transportation Committee as of January than any other state in the union. So that's pretty good, and we expect that to be an area of great activity and good success for the Commonwealth.
$435 million is going to Boston. How about the state entirely? How much of it?
So this is broken up in tranches, but directly to the state, for the state, is about $8 billion. So it's roughly $8 billion. But that's for the state, okay? So that doesn't count what Mayor Walsh is getting. You know, there's other money that goes. Yeah, separate community. I haven't counted everything up. I know what my district's getting, you know. So Quincy got $46 million. Brockton got $37. I think there's probably another $100 million. Yeah. I've got 23 towns and 3 cities, so it's tough for me to add all that up. But I'm ballparking, say probably $100 million. For my district, yeah. Yeah. But remember, it all goes by population, and we're pretty much, we're supposed to be fairly equal in size in terms of population, but I have Brockton, so that's a heavily hit community. I've got parts of Boston, very high rents, so there may be some discrepancy in terms of the comparison of money from district to district. It'll be common for population. I've got 727,514 people in my district. So, you know, and so that's not exactly the same in every single district, but we've tried to keep it pretty much the same.
You know, can I ask another question? We haven't had a chance really to ask the mayor about his departure from the city. He's going down. It's going to be become the labor secretary. I guess I'd ask you what you think about his impending approval of that position, and what it means to have him down there, and what it means to lose him up here.
Yeah. Well, I'm delighted for my friend's success. You know, Marty and I strapped the work boots on together. He was a laborers 223, Iron Workers Local 7 myself. We worked the same jobs together. You know, I knew his dad. I was pretty close with his uncle Pat, you know, Pat Walsh with the laborers. Those guys were role models in a very real way in the labor community. So, you know, I feel a certain kinship. Marty's my friend, you know. So I was very, very happy for him. I weighed in, along with many others, to try to persuade the president of the rightness of choosing Marty Walsh as labor secretary. I think it's been a long time, probably more than 150 years since we've had a labor secretary who knows what it's like to stand in the unemployment line, who knows what it's like to struggle. And so I think, given the circumstances of today's America, with the the equity gap and the issues that we are confronting as a workforce and in the job market, you know, I think Marty's a real blessing to have that perspective brought to the United States cabinet. So I told him, you know, I've got a studio apartment. Whereas when I went to Congress on a special election, I stayed with Capuano, slept on a zero bed. We're going to have to find some place for Secretary Walsh to stay until he gets settled down there. But I've already offered him. I had COVID for a couple of weeks, and I offered him my keys to my apartment because I had a sequester at home. But we're delighted. We're just so proud of him as a brother. You know, state building trades person, Boston building trades member. I'm an active member of the Iron Workers. To have one of our own chosen as labor secretary is a point of enormous pride for all of us. You know, sometimes the Times finds the person, and I think the Times have found soon to be Secretary Walsh. We got a lot of work to do. And by the way, in this American Rescue Act, there is some money for Secretary Walsh on on the issue of protecting workers in the workplace, OSHA inspections. There's a presumption of work-related causation for anybody who gets COVID when they go back to work. You don't have to fight that fight or where I got this. There's already a presumption of connection to the workplace, so that's something. But the mayor, soon to be Secretary of Labor, is coming into Congress at an important time for the American worker, and also at a much needed time for his expertise and his perspective.
A year to get to where we are. How long do you think we're going to be dealing with the impact of this?
Impact? Well, the money is scheduled to go out in 60 days. 60 days from passage, so that was last week. You know, I think you got to rely on the medical experts. I have read about this flare-up again in Italy, where they're back in lockdown. So we've got a ways to go here. I'm hoping that, you know, July, August, you know, the unemployment benefits, the plus up, and the federal extension of benefits is in September 6th. I think subconsciously, at least, we thought when we get to that point, we might be in a much better place. So we're hoping for the end of the summer, maybe Labor Day, to have a much better fix on where we're at, and we'll have a much higher level of population vaccinated. So this Thursday we will cross the 1 million mark. The 1 million mark in Massachusetts. So as of Thursday, we're at 900,000 and change. So by Thursday, we will cross 1 million Massachusetts residents who have got the vaccine. You know, so we'll have to reassess on our progress there. Like I said, with Moderna, Pfizer being asked for an extra 200 million doses, and with the J&J, Johnson & Johnson ramp up, we should really be able to push out these vaccines. It is still a matter of us persuading people to get the vaccine, but we're not out of this yet. So we've really got to stick to this and work hard. Keep wearing your masks until we get to a point where we've got that herd immunity, or a significant portion of our population protected. But it doesn't end there, right? You know, so this is a national effort. We've got to make sure every state is in a good place, and then we've got to do what America has always done, and that is to try to take care of countries that don't have the infrastructure, don't have the ability to protect their own citizens. And you know, in the past couple of years, I spent a fair amount of time in Africa. I worry about the strain, the South African strain. You've got some populations there in Nigeria, where you've got heavily, densely populated cities like Abuja and Lagos, where the access to health care is extremely limited. So we've really got to try to, like I say, do what America has always done, and remember our obligation as the most powerful nation on the planet. We've got to restore the faith in America by what we do with our international neighbors. We really do. So this is, you know, I agree with the idea. You got to get your own house in order. You really do first, before you can start helping other nations. But the minute, the second that we feel we are secure in this country, we have to look around us and make sure that we step up to our responsibility as an international neighbor to look at those countries that don't have the blessings that we have, and we've got to step up in a big way, like America has always done, and take our rightful role in eliminating this pandemic, you know, from the face of the earth. I heard the last. You know what? I cannot hear very well what that. Yeah, I'm sorry. Yeah, please.
When you talked about opposing these cuts with the MBTA, and you said that there have to be some hard discussions about the money that's allocated, what does that mean exactly? That you got full
Well, okay, so here's the dynamic. So we push this money out to the MBTA for the purpose of providing services and keeping people employed. These transportation workers are frontline workers. They have been on those buses. We have hundreds of cases of transportation workers in the Commonwealth who have come down with COVID for doing their job. These are frontline workers every single day, and now they get $1 billion, and they're going to take the $1 billion and lay people off. I don't think so. Or they're going to take the $1 billion and then leave people stranded. That doesn't work for us as a delegation, as the Massachusetts delegation. I've talked to my colleagues, and they are furious about this. So we need to have an adjustment in our attitudes. And I don't think it should be taken lightly that we have a transportation bill that's being debated right now. And if we don't have the cooperation and the partnership that we need with our transportation agencies, what does that do to the prospects of a successful transportation bill with respect to Massachusetts? We need to be all on the same page here. We need to all be rowing in the right direction. And so I'm hoping they understand the implications of our confidence in them to do the right thing. This is a moment, you know. This is a moment where you might have to absorb a little bit of pain on behalf of the people that you represent. And so I understand the difficulties. I understand where the ridership is right now. But the idea is to provide this money to get to the ridership to where it needs to be over the next weeks and months. This is it. This is the beginning of our opening. And to get the Commonwealth back to business. And what are they doing? They're cutting bus service. They're laying off employees. They're going in the opposite direction that we need to be going in. And so we seem to be going in different directions. And we've got to get on the same page. Look, I love the governor. I do. I give him A for effort. Secretary Pollock, I work with her on a regular basis. They came down to sit with me to go over the priorities for transportation in Massachusetts when I was the only member of the Transportation Committee from the Commonwealth. And, you know, I want to be a partner with them. This isn't working for me, laying people off and cutting service. It's not working. And so I'm asking them to please come back to the table. Let's talk. And let everybody get on the same page because there are important decisions that have to be made. There are important fights that need to be fought, and we need to be together if we're going to be successful on behalf of the people of Massachusetts.
Thank you, everyone.
Thank you. Thank you.
Mark, can I just ask a question about the high density of the North End? What that means exactly?
Yeah, so the question related to outdoor dining and sort of the delay, the short delay. Obviously, outdoor dining still has to have social distancing related to it. And so as we start to open up and ask restaurants to have plans, there's just a lot of restaurants on a small number of spaces in the North End. So part of it is to be able to extend the time frame for restaurants to get ready, right? I mean, the 22nd is the day for all restaurants, and there are, I think, 1 week later, the 29th. So it's just giving more time for folks. But I can't stress enough, just because you're outside doesn't mean that social distancing isn't still part of it. You can only have 6 people per table. Had a great experience with the North End last year, and just want to make sure we take the time to have another good experience. So the question is, what can they do in a week's time? And they can make sure that they're planning appropriately and that they have the time to be able to do it, right? We're talking about, if you remember last summer, there was a lot of spaces in the North End where folks were able to do that, which was amazing. We just want to make sure that folks have enough time to be able to make sure they're measuring everything out, that they have the spaces necessary so we can have a good experience again and keep people safe.
Already have those plans in place and the infrastructure from last time that they can pretty much just carbon copy that, right?
No.
Just in the North End, just so we're clear, the North End is going to be the first because there's a build-out that's required. It's not, in the North End, when we had barriers, we had actually physical barriers. It's not just tables and kind of barriers. It actually has to be built out. So we also are very cognizant of the community. The neighborhood is very concerned about losing all those spaces, and we don't want them to lose them too early. So the North End is a little different because it's all of Hanover Street, or most spaces of Hanover Street. So that's why we're keeping that on the first. Some of these other places, yeah, it's putting a Jersey barrier in. It might be just putting a wooden structure in certain spots in the neighborhood. Some of it's on the sidewalk, some of it's on the street. North End's a complete different. If you almost look, I would probably look at the North End almost like a complete build-out, if you will, of the whole street. Even though it's individual restaurants applying for the licenses, you're really building out the whole street. So that's the difference. And it's a little bit of the community wanting it on the first, not beforehand, and an inconvenience to the neighbors, and inconvenience to people. So that's why we did that. No, same as last year. It'll be the same as last year. We're talking about, people watching on TV, we're talking about Hanover Street, by the way, in the North End. I believe there's still going to be traffic like we did last year, things like that. We learned a lot last year. The issue as far as density goes, you still can only have 6 people at a table. You still can have limited capacity inside. And again, we're asking the restaurants and all the patrons that go to the North End to dinner, just remember, you go into somebody's neighborhood, and people in the second, third floors of those houses on Hanover Street, Salem Street, and all the other surrounding streets that there's outdoor dining, people live there, the kids, families. So we're asking you to be cognizant of that. And again, on the first, we'll have the full build out ready to go. All right, thank you.